Hello you guys, it's Christina and welcome back to my channel. It's been a little while since we just got to sit down and have one of these kind of videos, huh? I know I've been putting up a lot of promotional and product testing videos, and mostly it's because those are the videos that tend to have a deadline attached to them rather than these where it's kind of just up to me. So since I haven't been feeling particularly well and that up to editing, those are the videos that just end up getting done, and these are the ones that kind of fall to the wayside. I apologize about that. I'm not trying to turn this into like a sales channel or anything like that. Believe me, I am not racking in the dough, but I do have an appreciation for how important some of the little things in life can be, especially when you have a chronic illness. So that's where I'm coming from there, but it does feel good to be back to my roots a little bit and filming this kind of video. So today I really wanted to focus on my neurosurgery experience, more specifically my spinal surgeries. I have a video already all about my stent. I think that I might want to do a whole separate video about my shunt and about my tethered cord horror story from this past summer. So I'm really going to try to be focusing in on the fusion aspect, but in doing so I'm realizing that I'm gonna have to touch on some other things a little to give some context. So this is a video that I have been actively putting off making since probably the inception of this channel, and there's a few reasons behind that, but mostly it's just I feel like there's so much to be said that I could sit here for a million years and blabber, and I still wouldn't be able to say as much as I wish to. Also, I know that this topic can be a little bit controversial, even amongst doctors, so I have to really kind of tread lightly around certain things, but I also have to be pretty brutally honest, as I feel like I owe this video to myself because it did not exist when I started down my journey with spinal fusion, and I really wish it did, because to be perfectly honest, there's a lot that they don't tell you beforehand. Also, I had you guys submit some questions over on my Instagram the other day as part of my 30 days of giveaways for May, Ehlers Danlos Awareness Month. Woohoo! Come join us on Instagram. And you guys had a lot of awesome questions, so I've tried to work them into what I'm gonna say, and I'll also try to answer some of them at the end, so stay tuned for that. Let's just get into this, shall we? Disclaimers. 1. I'm clearly not a doctor. I can only give you my personal patient experience, what I have gone through, what I have personally observed. I have trusted my life to 4 different neurosurgeons in my 24 years, and I am quite biased at this point over who I prefer. The decisions that I have made were always based on what was the best decision to make in that moment, and who knows, looking back, if I would have done some things a little bit differently had I known then what I knew now. And lastly, I don't want to present this in any way as I have this horrible, severe case of this and it's way worse than yours and I deserve special treatment and I'm a special snowflake. No. We're not here to one-up each other. I know for a fact that a ton of you guys are dealing with exactly the same thing that I'm dealing with, and are maybe just in a different phase of that or haven't had the opportunity to have the treatment I've had. So I wanted to be very clear that I'm very grateful for all of the opportunities I've had, not because I particularly like having surgery, but because I received the care that I needed when I needed it, and ultimately it has saved my life. With a condition like this, we're all just dealt a hand and we're left to just fumble through life trying to figure out how to best deal with it. There are so many complications that I don't have to deal with, that a lot of you guys do. I'm very, very thankful, just as I'm sure a lot of you guys are glad that you haven't had to deal with spinal complications. So let's start at the very beginning. A very good place to start. I have it all written down. Actually, I think I do want to slip one more disclaimer in there before we start with the real story, and that is that you guys have come along on a lot of different things with me. You have come along on my journey for the last like 3 years, which is absolutely crazy, and thank you. But I should say that you guys came into my life at a time that I was actually pretty darn stable. It might not look like that, but I had already been through most of my journey with my spinal fusions. What you guys have observed has been more like touch-ups and broken hardware and complications. You guys never really got to see the before. It was not an easy time by any means, and I really wasn't very educated back then. I don't really have any documentation. I don't have any footage. Why would I? You know, I didn't know when I was before that I was a before. I had no reason to think that. So I'm sorry that I don't really have a lot of footage, but kind of not really, as a lot of this is a time in my life that's very painful to look back on. Okay, now we can get into the story. So if you remember from any of my previous videos, I was about 10-ish years old when things started to get funky. I might kind of go back and forth in saying like 10, 11, or 12. With a chronic illness, it's really difficult to put your finger on the exact moment when you got sick or when you first had symptoms, because there really isn't one. And a lot of things that are symptoms are things that you've been dealing with your whole life, and you kind of don't really know anything else. So looking back, it was about age 10 that I started to show problems, but I think it was about age 12 when my pediatrician started to refer me out to other specialists. My pediatrician was terrible, by the way. But it was about like the start of puberty when I started to notice things were abnormal. I definitely had a lot of pain, but I've mentioned before, I was a competitive gymnast. Pain was kind of par for course. A lot of girls had knee braces, a lot of girls had elbow braces, wrist braces. It just wasn't really that weird to be hurting. And I was the youngest on the team, so I was certainly not going to complain. If my hip was slightly out of commission or something, my coaches would just pop back in and we just move on. I believe like my 11th birthday, I got a stomach virus. I had this bug for like 6 months. I could not get rid of it. My ability to fight off other viral illnesses and infections seemed to go way down. I just could not stop getting sick. My GI was a wreck. It was not accepting food. I was in a ton of new pain. I was getting headaches. I was always overheating. I was super dizzy. And I was just developing new allergies after allergy after allergy. It was very strange. I had previously been a pretty healthy kid, so all of this just really took us by surprise. I can remember like totally panicking and like sobbing when I had to take my first inhaler and my first allergy pills, because I had never like had medicine before. We just were a healthy family. But over the years, time went on and I just wasn't really getting any better. I was actually getting a lot worse. I was being referred from specialist to specialist to specialist. I tried out a lot of different physical therapists in this time to try to help some of my joint pain, mainly my knee and my back. And we largely thought that most of my symptoms were coming from some kind of immune allergy problem. So we started treating me with weekly allergy shots, which I've since found out is not good for mast cell patients, but at least I'm not allergic to dogs anymore, so that's great. But after just being sent from specialist to specialist to specialist, I had really started to lose hope that we were ever going to figure out what was going on. I knew that a lot of these things had to be connected. I just didn't know how, because my symptoms were just all over the place, and they may have seemed like little things, but together I felt like it just couldn't be a coincidence. But all my tests were coming back fine. I didn't have celiac, I didn't have Lyme, I didn't have any problems with my thyroid. So I just kind of went about my life until I lost the ability to read. I've always been a huge reader. I love books. But all of a sudden, I couldn't even do my schoolwork anymore. The words were just moving around all over, jumping around the page. And really, I was losing my cognitive ability to understand what I was even reading. Then I started falling. It was the craziest thing. It was like nothing I had ever felt before. I would be totally fine one second, and the next thing I knew, the whole world just lurched and kind of met me on the floor. Like I was on the ground before I knew I had fallen. Everything just turned. So I went to my ENT, which stands for ears, nose, and throat. He is awesome, and I told him the problems I was having, and he told me it sounded like I had vertigo. So we decided to go ahead with the full panel of vestibular testing to figure out why I was having these problems. Your vestibular system is basically just responsible for interpreting the information that your eyes and your inner ear are sending to your brain to tell you where you are and your surroundings are in space. Not super fun testing. I 100% thought that it was going to come back normal, because why wouldn't it? All of my other tests had come back normal, but this one didn't. This one did show that I had a pretty severe weakness on my left side, which it doesn't really kind of matter which side, but my left side tends to be my poor side. But I did have a weakness. And having something come back positive honestly took me by surprise. So we got my braces taken off, and I went in for a brain MRI. At the time we were looking for tumors, which was terrifying, but instead we found something else, and that was a Chiari malformation. It's when the base of the brain, the cerebellum, sinks down, puts pressure on the brain stem and the surrounding nerves, and starts to block off the flow of fluid that should be running from your brain down your spine and back up. Now, this wasn't any fancy MRI. This wasn't an upright MRI. It wasn't inflection or extension. It was just a plain old lying down, run-of-the-mill MRI. So when people ask me if it's worth the trouble to get a regular MRI when they have suspected Chiari and no access to an upright MRI, I always say, absolutely. It's how we found mine. Not seeing one on an MRI doesn't necessarily mean you don't have it, but there is a chance it'll show up. So if it's all you have, it is worth a try. But anyway, off to the neurosurgeon we went. And every single person that I talked to in the medical field said that this was the surgeon to see. He was the go-to guy, the specialist. I was in the best hands I could be with. At this point, I was totally bedridden. I could not even move my eyes without vertigo attacks that could rival the fanciest of carnival rides. I wasn't keeping down food. My cognitive function had gone down so far, I had barely any idea where I was half the time. I was losing the ability to see, and I was losing the ability to breathe. I can remember showing up to the surgeon's office, and we had this big binder. I just had like 3 full handwritten pages of symptoms, and I handed it to him, and I was like, can this explain any of these? And I remember he kind of looked at it, and he looked at me, and he was like, well, I really can't promise that you're gonna be cured afterwards, but I do think that probably I can fix about 80% of these. And I was like, oh. Finally, after all of these years, my childhood, being carted from doctor to doctor, here was this guy telling me that he could fix like 80% of my problems with one surgery. That was amazing. Terrifying, but amazing to get that 80% improval. I was going to have to undergo brain surgery, which I guess we kind of expected to hear going to a brain surgeon, but it still hit us pretty hard. And I can remember my dad at the very end, you know, looking at him man to man and asking, if this was your child, what would you do? And he said, I would operate as soon as humanly possible. And that we did. And for about 6 weeks, I felt great. I definitely had that 80% improvement for 6 weeks. And then it all came back and more. I'm really not going to go too in-depth into symptoms, but basically my 3 pages came back, and now I was having these very intense seizure-like episodes. I had these constant twitches and jerks. I was like projectile vomiting a lot. I mean, I thought that my vomiting and nausea was bad before surgery, but this was like a whole new thing. And I was also having these really strange episodes where like half of my body would go like totally paralyzed and droopy and weird, and all this just crazy stuff started happening. And it was not good. But in the meantime, I was diagnosed with Ehlers Danlos Syndrome and POTS. And that in itself actually explained maybe the other 20% of symptoms that weren't from some of these neurological issues. If you want to know more about those stories, I do have a video on Chiari and Tethered. I have a video on POTS. I have a video on my EDS diagnosis story. I'll just link everything I can down below. But anyway, I was referred to a neurologist who treated me for seizures, and I was referred to a pain management doctor who took one look at me and was very concerned about my neurological state, and that there just had to be more going on than just this Chiari. And thank God for him. He was so well versed in EDS. He's still my savior. But he referred me to my current neurosurgeon, who truly specializes in patients with Ehlers Danlos. Oh, and actually, by this point, I had already sent my imaging into another EDS specialist neurosurgeon, and he got back to me to tell me that I would probably benefit from 2 different surgeries, and would I like to book them ahead of time since I was traveling without even seeing him ever in office. And I was extremely uncomfortable with that, so I was super glad to have this other option to get another opinion from someone who had worked with more patients like me before. Now, with my EDS diagnosis, the neurosurgeon who did my Chiari decompression would barely even look me in the eye. Unfortunately, that's where the controversy comes in with this subject. With EDS, surgery is kind of taboo. It's a big no-no. I mean, our tissue just doesn't tend to heal very well. We're definitely prone to complications. Who knows if he ever would have even done surgery on me, knowing that I had Ehlers Danlos in the first place. But he certainly wasn't interested in doing anymore. Not that I wanted it, I just wanted to feel better. I think that my dad was probably the most against me having any more surgery. He had seen me go through the Chiari decompression and how much that worsened my condition, and really just didn't want to see that happen again. But with the trajectory that my symptoms were taking, we were really running out of time. So my mom and I went and we met my surgeon for the first time. And actually what he had to offer was pretty similar to what my previous opinion was offering, except that he took the time to look me over, to do a physical exam, to go through my scans with me, to measure the angles right in front of me and explain what was happening, and that made all the difference. So yes, there is definitely merit in getting multiple opinions. I, at that point, had the opinion from 3 different neurosurgeons, and we could immediately tell which one was the best fit for me. I did not want to have any more surgery, but I knew that if I had to, that this was the guy that I was gonna go with. Get a second opinion, get a third opinion, get a fourth opinion. Do not listen to those people in your life who call it doctor shopping. A surgeon is an expert on the human body, and you are an expert on your body. And so you are going to have to work together to figure this out. And you need to be able to get along with that person and to understand each other. If you're not comfortable with the surgeon, then that is not the surgeon for you. Don't feel bad about that. That is not your own personal failure. Sometimes it truly just does come down to personality and communication. But I do caution you when going into an appointment for another opinion or even your first opinion, just try to go in with an open mind and not have too many expectations. They are the specialist. It is important to listen to what they say. You don't have to take their advice. I know that a lot of us go into these appointments already a little bit educated on what we're going to be discussing, and I don't think that's a bad thing at all. I don't think it's bad to look things up, and I don't think it's bad to know about your own condition. But I do think it is important to just have that moment to hear them out. Believe me, no matter how smart you think you are, you will learn something. So after seeing my surgeon, being given my neck brace, I came home and I threw myself into vestibular therapy and physical therapy, both of which I epically failed and was asked very kindly not to come back until I had had surgery. Basically, according to my initial imaging, we were dealing with quite a few problems that physical therapy just wasn't going to cut. My initial MRIs showed that I did have another malformation in my sacral spine, which is called the spina bifida occulta. It just meant that I was born missing some of the bone, and the tissue had never quite detached where it should have, which caused a tethered spinal cord with a bulging disc kind of right above there. My surgeon at the time was not really screening the thoracic and lumbar spine, so unfortunately we don't really know what was happening there at the time. But my upper spine, we could see that I was pretty much unstable all the way up and down my neck, but I had marked instability at my skull level, and there was just no amount of physical therapy that I could do to strengthen my neck that was ever going to right my skull. My previous surgeon had, well, I'm not going to say that he screwed up, because maybe this was the correct approach for a patient that did not have a connective tissue disorder, but he screwed up. He took out so much bone that I basically didn't even have anything at the base of my skull. And he also took out like the whole first vertebra. So my entire skull was just sinking. And it was just coming down, crushing my brainstem, blocking that flow again, crunching down on all of those nerves, causing total havoc in there. That Chiari decompression kind of left me a little bit screwed. Or rather, not screwed. This was a ton of information to take in, and we knew so little back then. But ultimately, we decided that the best course of action here would be to fuse my skull down to my second vertebra, just to lift it up there, get it off those nerves, and then I could go home and have a shot at strengthening the rest of my spine with my physical therapy. I had my first fusion, I believe, in 2013. I think I was 17. It was about a year after my Chiari decompression, and I know that was in 2012. These timelines are really difficult to keep track of. I remember waking up and even just opening my eyes for the first time, I felt incredible. I felt so much better. It was like I couldn't even believe that this is what normal people felt. Like I could see again, and I could think and breathe, and it was just incredible. I remember getting up. Standing for the first time after surgery was the weirdest feeling ever. I felt like I had no idea where I was, and I just, like, it was overwhelming. It was amazing. I couldn't believe it. I went from feeling like I had like a few more months to live to like my entire world opening back up. It was just an incredible experience. Unfortunately, 2 weeks later, I found myself going back under the knife. My tethered spinal cord didn't take too kindly to the increased strain on the cord that happened when they lifted my skull up, and I ended up becoming temporarily paralyzed, below the waist, incontinent, all that fun stuff. Luckily, we were still staying down there, about to leave, and he was pretty much able to get me into surgery straight from the emergency room. While he was in there, he put a little bit of bone in a plate and fused that little malformation I had, that occult spina bifida, as well. I woke up from surgery and my symptoms had reversed themselves pretty much immediately. I was able to walk like the next day, and that was that in my mind. I was cured. I get probably dozens of questions a day sometimes asking how I made the decision to go through with my first spinal fusion. And I would have to say that I felt at the time, and I still feel like I didn't really have any other options available. I was sick. I had very little quality of life, and I was very, very close to not being able to breathe. Things had just really become critical, and we were operating on borrowed time. I know that everybody experiences their instability slightly differently, and that some people are even able to live a normal life with instability and not undergo surgery. But that was just not my experience. I was truly just afraid to even go to sleep at that point because I wasn't sure if I was gonna wake up. So anyway, I had the skull to see too, and then I had the kind of emergent tethered cord release, which really isn't too uncommon to need after a fusion because of that little bit of extra tug on the cord. It's not always so fast to progress, but it is a common thing. Looking back though, I think I am kind of glad that I had them back to back, as that way I had just like one big recovery instead of two separate recoveries. People were asking how I tolerated anesthesia, and at first, those first couple surgeries, I had absolutely no problem with anesthesia and intubation. I had some reactions to the dressings and to the sutures and steri strips afterwards, but we've since learned what works for me. I now have some more issues when it comes to intubation and sedation. A lot of that comes with some of the other complications that I've gone through over the years. It's harder to get the breathing tube down each time as I have more damage from repeat surgeries, and they can't tilt my head back and open my mouth very wide. But after those two surgeries, I thought, hey, I'm done. I'm fixed. I'm cured. We packed up our stuff, we said our goodbyes, and we left to turn back to normal life. We just knew nothing back then. We had no reason to expect anything different. My surgeon was confident that this was going to be it. We were confident that this was going to be it. And that was that. Until it wasn't. So here's where I pause the story to answer another one of your questions. I get asked this quite frequently, and that is, what advice do I have for someone who is just kind of starting along that neurosurgical journey? And my advice there is get the full picture. I knew nothing going into this. There's so much I wish I knew. If at all possible, before going under the knife, find out, do you have a tethered cord? Do you have Ehlers syndrome where your styloids are in the way? Do you have increased intracranial pressure or stenosis in the veins in your brain? Do you have TMJ? Do you have sleep apnea? Do you have other areas of your spine that are unstable? These are all really important things to know before going through with fusion surgery. Why is this so important to know ahead of hand? Fusion surgery is not a cure. Unfortunately, there's something called the domino effect, or adjacent segment degeneration. Basically, that means that when you fuse an area of the spine, you're taking away the motion between just those levels that you fused, and then the levels around it are now going to have to take the brunt of the movement that you just took away. If that level that's next to it is already unstable, you are just transferring more and more and more onto those unstable levels. That is where the controversy lies in this, because a lot of times you're going to need repeat surgery, and sometimes that's 10 years down the line, and sometimes it's like 2 weeks. And it's really, really difficult for a surgeon to know going into it which one of those patients you will be. But like I mentioned, my original imaging showed further instability in my neck, and we didn't address that because we didn't know to. My surgeon was much more new to this at this time. We were new to this. We just didn't know. So we didn't address it right away. But now, from what I understand, there is a lot more understanding about these conditions in the EDS world, and doctors are smartening up a little bit on just how important it is to have that full picture before they go into it. So my advice to you guys who are just starting out, if your doctor notes on your original imaging any kind of instability, make sure to address that. You know, bring it up. Just say, hey, I mean, I really would rather not have repeat surgery 3 months down the line, so can we talk about which levels need to be fused in order for me to have the best success here? And the answer may be to leave them and to try to strengthen with physical therapy. That is a possible thing to do. It's just something that you're going to have to really commit to, and sometimes it's too late. And unfortunately, in my case, that is what proved to be true. So do I have any regrets? Yes, I regret not knowing. I regret not having the full picture and not being able to ask the questions that I wish that I had asked. But I think that we were going off of what we knew at the time. My surgeon was going off what he knew at the time, and there's not really a whole lot we can do about that now. I also think it's important to note that if you are doing any kind of self-pay and crowdfunding, just be really aware that repeat surgery is not that rare. You might want to be prepared financially going into it for the possibility of having to undergo more than one surgery. Maybe you won't, many people don't, but it is important to keep that in your head and make sure you have that cushion, because it kills me to see people who are raising money for surgeries and then end up stuck because they spent years raising that money and are left with continued problems that they are unable to fix. Another question, is there a lot of merit to seeing a surgeon that is specifically trained in EDS? And my answer to that one is absolutely, absolutely yes. As you saw from my experience, even the best of the best in their field isn't always the best of the best with EDS, which meant we had to travel. But it's hard for me to even think about putting my trust into a non-EDS educated surgeon at this point, after my experience with my original surgeon and just how much grief I could have avoided had I known to see an EDS surgeon in the first place. People like to criticize these EDS surgeons for being too surgery happy, and I'm here to come on the record to tell you that that, in my case at least, was far from the truth. They see all of the different surgeries that I've been through and all of the various fusions, and they look at it and think, wow, he really screwed up to have to do it that many times and to have to keep going back in. That is why we don't do surgery on EDS patients. And I would like to counter that with, the spine is a very long set of joints. And the reason that I had so many surgeries was because my surgeon was very conservative in his decision to do surgery. We did a lot of little pieces just to try to salvage any movement that we could in my spine and give me a chance to strengthen it. Unfortunately, it didn't really work out for me, but the number of surgeries does not reflect his willingness to do them. Rather, it reflects his unwillingness to do them. In my case, every single time we decided to go ahead with surgery, it was because I could not physically go on in the condition I was in. I would come home, start my recovery, start getting back into therapy, getting my body moving, and then the next part would just go, and I would be right back to that place where, you know, I wasn't breathing, I wasn't able to eat, I couldn't walk, I couldn't see, I could barely speak. I was in and out of consciousness, losing feeling and abilities to move various parts of my body. Really, there just wasn't a choice. And I think that a lot of doctors have smartened up over the years as they've seen this continued progression. And they're not waiting quite as long. And maybe that is perceived as surgery happy, but to me that is just perceived as experience. Sometimes I look back and I do wish that we had done larger sections of my spine at once instead of going for all of these little pieces, because that is why you guys have seen me go back and have to have various areas redone, because I had to have things connected that were kind of shifting against each other. I don't see that being done quite as often anymore, so I think that I was a bit of a guinea pig for a while. So how long did I last after my first fusion and my tethered cord surgery? I think it was probably about 3 or 4 months in that we realized that I was probably going to need more surgery. Of course, we're thinking again, like, it's just one last little piece to fix and then we're done. I went to summer camp like 6 weeks after my surgery. I really was doing quite well until I wasn't. So I went down and I had my C4-5 fused in my neck, and I actually had that done anteriorly. You can barely even see the scar now, but I had it fused from the front. So I have a little plate and some screws here. The recovery was incredibly easy from that surgery. 10 days later, I was back here at home going for like a walk around the local park and just feeling pretty great. But unfortunately, that fusion also didn't hold up for very long, and I also lost quite a bit of my ability to swallow from that surgery, and I actually still haven't fully gained that back. It's part of why I was on a feeding tube for about 3 years, but really just a small part of it. There really is a whole lot more to that story, which actually I can link that down below as well. I just really wonder what my experience would have been like if we had started by just fusing all of the areas of instability that we could see, which I think that more and more doctors are doing now. I don't know, maybe I would have had a better outcome with some things. I would have less damage. Maybe I would be able to swallow better, but maybe it would have hastened my decline even more. I have no idea, and I have no way of knowing. There's nobody that I can look at who's like 10 years down the line and has been through all of this and can tell me what my life is going to be like and what this recovery looks like. This is a new generation of medicine and a new take on treatment. I don't have those answers and can only continue to make the best decisions that I can with the knowledge that I currently have in the moment. I'd like to say that things got a lot better from there, but unfortunately the next few years of my life were really just surgery, recovery, surgery, recovery, surgery, recovery. I really did fall prey to that domino effect. I didn't have the strength built up to hold my spine together, especially after surgeries on that area, cutting through those muscles. I mean, I was unable to strengthen myself enough to avoid fusion, and sometimes I blame myself and wonder why I just wasn't able to be stronger. And the answer is that I have a connective tissue disorder. My soft tissue was just too loose to support my spine, and that was not my fault. After my C4-5 fusion, I was fitted into a custom hard shell thoracic lumbar sacral brace, but that did help to slow down progression a little bit for a little while. My thoracic spine, which runs from just about below your neck here down to about, I don't know, your belly button, where your lumbar spine takes over. The brace did help while I recovered from my cervical surgery, but anytime we would take it off to even change, I would stop breathing, I would go into seizures, and eventually the brace was working less and less. I definitely could not walk. I was just out of it, and it was dangerous. I could not be left alone because you just never knew when I was going to stop breathing. I believe it was after one particularly close case of me stopping breathing while home alone that caused me to ultimately call my surgeon up and be like, we need to readdress this. And at this time, my surgeon really wasn't doing thoracic fusions. It wasn't done, really, not for this. It was done for scoliosis patients and people who broke things, but EDS was just kind of this new frontier in spinal surgery, and none of us had any idea what the outcome would be like. But we knew we couldn't leave things the way they were. So we traveled back down to my surgeon, and I underwent quite a lot of testing. I had so many images done. I went for second opinions from everyone he wanted me to see. We tried medications. We did more imaging. Eventually, I'm told, because I actually have quite a bit of amnesia surrounding this time, which is probably for the best, that we went to a manual therapist type doctor that my surgeon had kind of begged to see me. He took off my brace, slid his hands under, and immediately I went into like full body just seizing, and I stopped breathing, and he panicked, just shoved me back in the brace as fast as he could and just sent me away. Apparently my surgeon had to like beg him to see me one more time, just get an idea of what he could feel. And he went down the line and noted which of my vertebrae were the worst off, and it happened to coincide pretty much exactly with what my imaging was showing and what my symptoms were showing. I believe I was like probably one of the third patients to have a thoracic fusion of this kind with this doctor, and I believe it was the largest that he had done at the time. He wasn't really expecting that great of an outcome, but we had to do something. The last thing I remember really was being in the ER, and I was gasping just to get any breath, and I remember everybody was standing over me and taking turns like manually holding my spine in place from the back and from the front so I could take breaths until an OR room opened up. So yeah, maybe we waited a little bit too long on that one while we were getting all the facts, but I am glad that we were very thorough ahead of time and went into it with as good of a picture as we could get at the time. That being said, this recovery was probably the worst recovery I've ever been through. I thought, you know, going in, I had had surgery before, so I knew what to expect, and I was so wrong. Thoracic surgery is a total beast to recover from. 3 months after my thoracic fusion, I woke up in a rehab facility here at home with like no memory of ever getting there. The sheer pain was something I had never experienced before, and to be honest, it's been years and I'm not sure if I'll ever be fully recovered from that procedure. But out of all of those procedures that I've ever had, that very first thoracic fusion was the one that probably came the closest to really saving my life. It's impossible to know what the outcome is going to be. A lot of you guys had questions about recovery, and that is just totally all over the map depending on the person, on the surgery, on so many different factors. I can tell you that every single one was totally different and totally different recovery. I'm gonna have to just say it again, surgery is not a cure for instability. It is a treatment, and it is a treatment that comes with its own set of problems. I am not pain-free, not even close. I cannot twist, bend, or move any of my spine. The only movement I have here are my shoulders, and then down, way down at my hips and SI joints, which by the way have taken on all of the movement and weight in my body pretty much, and so they have suffered quite a bit. It's that same domino effect. I can't make a bed, and I can't reach something on a shelf because I can't see anything above or below eye level. If I'm sitting here and something's next to me, it doesn't matter how close it is to me, I can't tell where it is. I function 99% of the time blind, therefore I have to kind of know where everything is at all times, which can be a little bit stressful. I can't stand at the stove and stir things for long periods of time, and I certainly cannot drive. I do know some people who do drive after cervical fusions. I don't know anyone who's fully fused who drives. Maybe I will be the first, but I'm told that I have to start at driver's rehab to see if I qualify and if there are any adaptions that they can make for me. You don't really want someone on the road who can't look out the car mirror, never mind like turn around and see where they're backing up. I can't take a full breath because my ribs now move differently. My gut and my diaphragm move differently. Everything moves differently, but I'm alive. So that's the depressing part, but you guys did have quite a few questions on some of the things that I can and can't do. And I think that some of the things that I can do were more surprising than the things I can't. And one of the things I can still do is touch my toes while standing. I can shave my own legs. I get asked that quite often. I can no longer play the violin as I can't hold it with my chin, but I can now play the ukulele by holding it facing me and strumming like this. If there's a will, there's a way. Now, how did things go after that thoracic surgery? Well, oh man, I wish I could say that they went better, but it was just one after the next. I had a lot of luck in rehab learning to walk again, but unfortunately they just didn't understand my condition fully and ended up putting too much weight on my upper body, thinking they were treating a shoulder injury, which ended up really screwing up my neck and causing me to need to have my entire neck refused, and probably ultimately like leading to the rest of the fusions. But I really don't want to scare you away from rehabilitation, because I don't know what I would do without my physical therapy. That is my biggest piece of advice for people who decide to go through with surgery, is to make sure that you have a good team lined up for you waiting for when you get home, because that is truly the key to a successful fusion and recovery. You want to have a therapist who's familiar with your case, who's familiar with EDS, and can really help you to strengthen those areas without causing any more injury and putting any more strain unnecessarily on other areas that are already compromised. And I think that it's important to have a good pain management doctor as well, someone to help you wean off of those post-surgical medications and then kind of reevaluate where you are and what you still need to be doing or taking to continue along with your success. So after hearing my particularly uplifting tales from surgery, you might be wondering, what the heck does success even look like as a spinal fusion patient? And believe me, there is so much hope. There's so much more to my story than just spinal fusion, and at no point in my story was anything happening within a vacuum. For me, my symptoms were never really straightforward, totally straight cut spinal instability. I had a lot of issues going on with the pressure in my brain, stuff like that, that complicated things. I also fell and really screwed up my pelvis. So I'm unfortunately not really sitting here as the perfect picture of health and vitality that I wish I was. Up until my fall after my last surgery, I was doing really well. So as for what to expect after surgery, I have a very disappointing answer for you. And that is, it is different for absolutely everybody. Recovery was the #1 topic you guys wanted to discuss, and I just wish that I had better answers for you. But all I can do is share my own experience, and this is it. Oftentimes it's a lifelong thing, but I have met a lot of fusion patients, and I don't think I've met any of them who have said that they would go back and not do it. I wouldn't be here today without it. And I think that some of you are actually looking for more helpful, like constructive answers to the recovery questions, so maybe I will make that a separate video as well, just exactly kind of what to expect in your pre and post hospital experience, and then going from hospital to where you are staying or living and how that works. I think I'll definitely have to film that one, because come to think of it, I would have loved to have that video before my surgeries. But really, that's my story. I apologize that I didn't go level by level, angle by angle with all of my imaging and tell you which symptoms got better with each single level and each single surgery, but it's something that I can't do. And I don't think it would be helpful even if I did, because we are all so different and we are all dealing with all of these things at once. Complications, they do happen. You guys have seen it. Hardware can break, fusions can fail, infections can set in. You could take a fall and break your butt. I feel like I've been kind of a bad example. It is just part of the gamble that you enter in, and I wish that somebody had been a little bit more open with me beforehand. You guys have been through it with me, and I think that maybe sometimes because you guys have mostly just seen the complications and the revision surgeries with me, that it's kind of skewed your point of view a little bit, because you never got to see where we started from. You only got to really see like the more negative sides of things. You've seen firsthand how dysautonomia, mast cell activation syndrome, and adrenal sufficiency can also kind of flare up along with these surgeries. I feel like I've been kind of a bad example. And I'm not here to like compare my experience with anyone else's, because like I said, everyone's experience is so different. But if you had seen what the before looked like, you might have a better understanding of how we got to where we are now and why I continue to be so thankful for this. I can't show that and I can't voice that in like a social media post or in a 5-minute vlog clip, even if those things were in my life at the time. And I don't expect to know exactly what you're going through when I see your social media posts. The stories that we put out there for others are ultimately going to be lacking, and that's just how it is. Is it hard not to compare yourself to other people on social media? Yes. I am even guilty of this. I have to say that I see people all the time who are experiencing their conditions differently. It makes me wonder what I would do if I were in their shoes, or if I had their presentation. Sometimes that can even lead to envy, which I admit really isn't healthy, but it's the truth. I have to remind myself that things then were different, and the reason that people are having earlier intervention and better success is because we had to learn a lot through trial and error. And everything we do, we are still learning. And I think that it's a wonderful privilege for me to get to go online every single day and see how far we've come and see maybe like the different approaches that the doctors are taking and know quite personally why methods are changing. So would I do it all again? Yes, I would do it all again. Despite my wish to have known more going into this process, if I genuinely had to do everything exactly the same again to get to where I am now, I'd do it. When people say that these surgeries are life-saving, they're not just saying that to be dramatic. These procedures saved my life. And yes, it's a life worth living. I had someone ask what it's like to live in such a fragile body, and I would say a lot of adaptations. My general surroundings have been adapted to my needs, but the world as a whole has not. Leaving the house is an ordeal that takes hours to prepare for, if not days. My daily routine is dictated by medications and treatments and appointments. I get a lot of criticism that, oh my gosh, like all she ever thinks about and talks about is her illness, her entire life revolves around it. And while I have some critiques there, that's a fair point. I would say that my condition and my fusion does affect every part of my life and everything I do. But I share my story with you guys to create a sense of community and education, not for like personal attention. I feel like if I wanted attention, I probably would have picked a condition that people have heard of and actually care about. But on the other hand, I do also receive a bit of criticism for how much I can do, and that I can't really be that sick because I'm able to do this or that. Which kind of makes me laugh a little because I've been incredibly frustrated with just how little I've been able to do lately. I guess you really just can't win in everybody's book. Some people look at my life and think, wow, she's really not able to do much. And then other people look at my life and think, wow, she does too much. But what are you gonna do? This isn't the life I asked for. This isn't the life I wanted, but this is the life that I was given. And because of these surgeries, I still have it. And for that, I am grateful. Okay, well, that is my story. Well, part of it anyway. Hopefully I can continue this along fairly smoothly with my shunt video and answer some of the remaining questions. One single remaining question, can I feel the hardware? Answer is absolutely yes. It feels like a roller coaster track going down my back. It's very lumpy, and the screws in my skull that are holding the plate on are extremely tactile. They stick out a lot. It's because I had to have a special plate made because my first doctor screwed up so much that there wasn't any bone to screw the plate to. So yeah, you can really feel the hardware, and I can feel it when I move, as my muscles and ligaments are not fused and still move about my spine and have to hold it up. So sometimes there's quite a bit of fighting going on between those muscles and that hardware. Someone please come and tell my muscles that I'm fused and ask them to stop fighting my hardware. Thank you. If you liked this video, it'd be awesome if you give it a thumbs up. And if you want to know when I post my next video, you can hit that subscribe button and hit the little bell icon. That way you'll be notified right away when I upload, and we can talk in the comments a little bit before it starts to get crazy. Also, again, come join us over on Instagram for the remainder of the 30 days of giveaways. We have given away so many cool prizes so far, and I have more in store for you, so come check me out. Go in my story. I would love to see you there. And until next time, goodbye!